Here we are performing the straight leg raise test, or the test of Lasegue. The patient will be supine on the table, and the examiner will be at the side of the tested leg. One hand grasped under the heel, while the other is placed on the anterior knee to keep in full extension during the examination. While keeping the knee in extension, the examiner raises the leg by flexing the hip until discomfort is experienced or the full range of motion is obtained. A positive test is when the patient complains of pain before the end of the normal range of motion, about 70 degrees. The pain may be described as radiating distally along the tested leg, usually in the posterior thigh, radiating into the calf and perhaps the foot. The findings are highly significant if they are elicited at 30 degrees or less of hip flexion. Implications of this test are sciatic nerve irritation or compression. Pain described before the hip reaches 70 degrees of hip flexion may indicate disc involvement. Some modifications of this test are after pain is experienced, the leg is lowered to the point at which the pain stops. The examiner passively dorsiflexes the ankle and or has the patient flex the cervical spine. Serving to stretch the dural sheath, this flexion recreates the symptoms. If the patient's prior pain was caused by tight hamstrings, this modification does not elicit pain. The straight leg raise may be helpful in differentiating between tarsal tunnel syndrome and plantar fasciitis. Beginning with the foot dorsiflex and everted additionally stresses the tibial nerve. The straight leg raise is then performed. An increase in symptoms points to tibial nerve entrapment because strain on the plantar fascia would not further increase.